What's up, TUMNAD lectures? In this video, I'm going to take you through on what we call the circle of Willis. In the previous video, we looked at what we call the origin of the two kind of the arterial systems that make up what we call the circle of Willis. Today, we are going to go into step by step and see all the different kind of the branches that are going to be leading to what we call the circle of Willis. But please, if it's the very first time to watch it, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. During the study of the circle of Willis, now the circle of Willis is going to be that ring-like structural arrangement which is going to be made by what we call the vertebral basilar system, that is at the posterior part, and then also what we call the internal carotid artery, which is going to be supplying on what we call the anterior portion. Now, the internal carotid artery is going to be supplying approximately around 80% of the blood circulating to what we call the circle of Willis. And of course, what we call the vertebral basilar system is going to be supplying approximately around 20%. And it's going to be supplying the posterior aspect of what we call of the brain. And then the internal carotid artery is going to be supplying the anterior portions of what we call of the brain. Now, this diagrammatic illustration you are seeing here is showing us what we call the circle of Willis. Now, this one here is going to be now the brain. So this is going to be now what we call the left hemisphere. And then this one here is going to be what we call the right hemisphere. Now, this diagrammatic illustration, we are looking at it at an inferior view. Okay? This is the inferior view of this diagrammatic illustrations. Okay? Now, to start it off, we are going to first have some little bit of what we call the orientation of this diagram. Now, this portion here is going to be what we call the spinal cord. And then as you enter around here, this is going to be now what we call the medulla oblongata. Okay. And then this is going to be transitioning to what we call to the pons. Okay. And then the last one up is going to be what we call the midbrain. Okay. Let's go ahead and get started and look how are these kind of the arteries, how are they going to be passing, and then they supply on different portions of what we call of the brain. Okay. Now, before we start it off, we need to first understand where is the circle of Willis, where is it going to be residing. This kind of the circle of Willis is mainly going to be located at the base of the brain. Okay, it's going to be located at the base of the brain, around what we call the optic chiasm and what we call the pituitary stalk. That kind of the stalk which leads to what we call the pituitary gland. And this kind of the circle of Willis, it is going to be located within what we call the subarachnoid space. It is always swimming in what we call the cerebrospinal fluid. What does this one mean? It means that these kind of the arteries, they have to pierce what we call the layers of what we call the central nervous system, which includes they have to pierce what we call the dura mater. They also pierce what we call the arachnoid mater, and then they start floating in what we call the subarachnoid space, where we have the cerebrospinal fluid. Okay, that is the basic to know. Now let's go ahead and get started. Now, when you look on what we call these arteries here, these ones here, the one which are going to be coming off from what we call the right and then the left subclavian arteries. These kind of the arteries which comes off, if you watch that previous video, we called them the vertebral arteries. Now, because that this is going to be the left side and this one is going to be the right side, we are just going to be giving them right, left, depending on the area where we are going to be labeling it from. Okay. Now, we said that these kind of the arteries which we are calling the vertebral arteries, the right and then the left, they are going to be coming from what we call the subclavian arteries, and then they move and then they enter what we call the cervical vertebra around C6, and then they pass through what we call the transverse foramina. They move up until they reach around C1, where they're going to be what we call the atlas. From there, they will just move a bit back from there, and then they pass through what we call the suboccipital triangle, and then they enter through what we call the foramen magnum. Okay, that's how they're going to be moving to enter into what we call the skull, what we call the cranial cavity. Okay. Now, these two guys here are what we call the vertebral arteries. But because this one is going to be the left side, this one here is going to be what we call the left vertebral artery. Okay. So now, this one here is going to be what we call the left. Is going to be what we call the left vertebral artery. Okay, and then of course this side is going to be what we call the right vertebral artery. Now, when these vertebral arteries, the right and left, when they move up, they reach at the level of what we call the medulla oblongata. We have these small kind of these branches here. Okay, these branches here. You know how we call these branches here? These branches here are very much special. This branch here is what we call the posterior inferior cerebellar artery. Okay, this one here is what we call the posterior inferior cerebellar cerebellar artery. Okay, which at times is denoted as pica. Okay, which at times is noted as pica. Now, what happens is that this kind of the posterior inferior cerebellar artery, it has of some kind of these little kind of these branches. You see this kind of these little branches. These branches here are what we call the posterior spinal artery. Okay, so now this one here is what we call the posterior spinal artery. Okay, is what we call the posterior spinal artery. Okay, so now that's what we call the posterior spinal artery. Now, when this kind of the vertebral artery move up, together they combine and they make this big kind of this artery. But before that, we also still have these kind of these branches. Before they unite, we have these kind of these branches here. These branches here are so much special. You know how these branches are called? These branches here are what we call the anterior spinal artery. Okay, so now this kind of the branch here is what we call the anterior spinal artery. Okay, is what we call the anterior spinal artery. Okay. Now, as we have said that these vertebral arteries, when they come up together around what we call the pontomedullary junction here, we are going to be seeing this kind of the vertebral arteries coming together, and they make this kind of this big kind of this big artery. You know how this big artery is called? This one here is going to be very big. This kind of the artery is so much special. This kind of the artery is what we call the basilar artery. Okay, so now this kind of this artery here is what we call the basilar artery. Okay, is what we call the basilar artery. Okay, super very important. Okay, now on this kind of the basilar artery, just close on where they are coming together, we have this kind of the specific type of this kind of this artery. You see this kind of these arteries are so much special. This one here, the one which is going to be coming off just immediately after it has come together, after the union of what we call the right and then the left, what we call vertebral artery. This kind of this branch here, this one here is what we call the anterior inferior cerebellar artery. Okay, so now this one here is what we call the anterior inferior cerebellar. Okay, cerebellar artery. Okay, it is such another a beautiful thing. Okay. Now, we also have this kind of the artery on the basilar artery. This one just above what we call the anterior inferior cerebellar artery. This kind of this artery here is very much special. This kind of this artery here is what we call the labyrinthine artery. Okay, so now this kind of this artery here is what we call the labyrinthine. Okay, is what we call the labyrinthine. Okay, what we call the labyrinthine artery. And some other people may call it what we call the internal acoustic artery. Also, even some people call the internal auditory artery. Okay, it is super very important. Okay. Now, when we come off again on what we call the basilar artery, we have this very kind of important kind of these branches. These arteries here, they are so much special. Okay, these arteries here, the whole of these ones here, they are so much special. You know how these arteries are called? These kind of arteries are what we call the pontine arteries. Okay, these kind of the arteries here are what we call the pontine. Okay, are what we call the pontine artery. Super very important. Okay. So now, as we move up around what we call the junction between what we call the pons and what we call the midbrain, we still have this very important kind of this branch. You see this kind of this branch. This branch is what we call the superior cerebellar artery. Okay, this branch is what we call the superior cerebellar. Is what we call the superior cerebellar cerebellar artery. Okay, super very important. And then again, when you move just slightly up, we again have another kind of a beautiful kind of this artery. You see this kind of these arteries here. This one here, they are so much special. This kind of these arteries here are simply called, they are what we call the posterior cerebral artery. Okay, these ones here are what we call the posterior cerebral artery. They are super very important. When you look at this artery, it has two kind of the portions. It has from here, for example, from here up to here, and then from here up to here. So now this one is going to be, for example, is going to be P1, and then this one here is going to be what we call the P2. Okay, and even also on the same side, the other side is also going to be the same. This side from here up to here is going to be what we call the P1, and then from here up to here is going to be what we call the P2. Okay, but the whole of it collectively is what we call the posterior cerebral artery. Okay. Now, when we come on what we call the midsection of this artery, we have this big kind of the artery which is branching off. You see this kind of this of anastomosis. They are going to be coming together. This kind of the anastomosis here is super very important. You know how these arteries are called? These arteries here are what we call the posterior communicating artery. Okay, these kind of the arteries here are what we call the posterior is what we call the posterior communicating, posterior communicating, posterior communicating arteries. Okay, so now these are the arteries which are also going to be making part of what we call the circle of Willis. Okay. Now, as we move up, we have this structure here which we call the optic chiasm. We still have special type of different kind of arteries that contribute to what we call to the circle of Willis. You see this artery here. These arteries here are so much special. They are is what we call the internal carotid artery. Now, this one is going to be what we call the right, and then this side we are going to call the left internal carotid artery. So now this one here is what we call the right, internal, carotid, carotid artery. Okay, super very important. And then of course this one here is going to be what we call the left internal carotid artery. Okay. Now, when you see this artery, is going to be having this beautiful kind of this branch. You see this kind of this branch here. This branch here is so much special, and this artery here, this branch is what we call the ophthalmic artery. Okay, so now this branch here, this one here is what we call ophthalmic artery. Okay, this one here is what we call ophthalmic, ophthalmic artery. Super very important. And then also this branch here is also very important. This branch here is what we call the middle cerebral artery. Okay, is what we call the middle cerebral, the middle cerebral artery. Okay, super very important. And then when you look on what we call the middle cerebral artery, we still have these tiny these branches which are going to be supplying, especially what we call the internal capsule. These small branches from the middle cerebral artery, they are what we call lenticular striate artery. Okay, these branches here, they are collectively called lenticular. They are called what we call lenticular striate artery. Super very important, supplying areas of what we call the internal capsule and some other of the areas. Okay. Now, when you come over on this artery here, you see this artery here, which is the same as this one here. These arteries here, which are also coming off from what we call the middle cerebral artery, they are so much special. And this one here is what we call the anterior choroidal artery. Okay, so now this one here is what we call the anterior choroidal artery. Okay, is what we call the anterior choroidal artery. Okay, super very important. Now, when we come over here, we see now this posterior communicating artery. As it comes over here, we still have these beautiful these arteries. You see these arteries here. We have what we call the right, and then this one which is at the left. This one here is what we call the anterior cerebral artery. Okay, so now these ones here are what we call the anterior, cerebral artery. They are super very important. Now, when you come over the anterior cerebral artery on the right and then on the left, they have a specific the branch here, which is going to be uniting both right and then the left anterior cerebral artery. This the branch is so much special, especially whenever there is any the damage on one of the great vessels of what we call the sac of Willis. It can help in the shunting of the blood to the other side to make sure that there is continuous supply of what we call over the blood. This the connection here between the right and then the left anterior cerebral artery is what we call the anterior communicating artery. Okay, this one here is what we call the anterior communicating artery. Okay, what we call the anterior communicating artery. Okay, so now those are the different arteries that come together to make this this structure which we are calling the circle of Willis. Now that we have seen the basic the arteries that make up what we call the circle of Willis, let's go ahead and have a very quick recap of what we have just said. We said that we're going to be having we're going to be having what we call the vertebral arteries, both the right and the left. They're going to be moving up and they end around the C6 or the cervical vertebrae through what we call the transverse foramina, and they move up. When they reach around C1, you're going to be having now what we call the atlas, where they're going to be moving at the back and they pass through what we call suboccipital triangle. Now, the suboccipital triangle is going to be bordering three the greater muscles. You're going to be having what we call the rectus capitis posterior major. You're going to be having what we call the obliquus capitis superior and then obliquus capitis inferior. So now it is within that suboccipital triangle where we're going to be having what we call the vertebral arteries going to be passing. And they now finally enter what we call the foramen magnum. And once they've entered the foramen magnum, they are now within the what we call the cranial cavity. They will move up and they move up. You're going to be having now these branches which we are calling the posterior inferior cerebellar artery, which are also going to be giving off little the branches which we call the posterior spinal artery, which are going to be supplying the posterior 1/3 what we call the spinal cord. When these vertebral arteries moves up, they're going to be giving off these tiny the branches which we call the anterior spinal artery, which supplies the 2/3 of what we call the anterior portion of what we call of the spinal cord. Now, as they move up these vertebral arteries at the level of around the pontomedial junction, they are coming together and they make this big of what we call the basilar artery. Okay, so now this one here is what we call the basilar artery. Now, on its union at the start here, we are going to be having this this branch with this artery, which we are calling the anterior inferior cerebellar artery, which can be denoted as AICA. Okay. Then just slightly next what we call the eye can also have another kind of the artery. These branches are going to be on the base of what we call the basilar artery, which you're calling the labyrinthine artery, which some other people call the internal acoustic or what we call internal auditory artery. And they're also going to be supplying different areas within what we call the ear. Okay. Now, as we move up, we're also going to be having these different kind of the branches on what we call on the basilar artery. These branches, they are collectively known as the pontine artery. Okay. And then as we move up around what we call the mid junction between what we call the midbrain and what we call the pons, we still have now splitting of what we call the basilar artery. It is giving us two kind of the major branches. It is giving us this branch which we are calling the superior cerebellar artery. This is going to be supplying the superior aspect of what we call of the cerebellum. And then finally, also going to be having another kind of this big branch, okay? This big branch which we call the posterior cerebral artery. This is going to be at the back of what we call or the circle of Willis. However, the posterior cerebral artery has two kind of the portions or the segments. We have this one from here up to here, which we call the P1, and then from here up to here, which we call the P2. Okay, so now this is going to be what we call the left posterior cerebral artery, and this one is going to be what we call the right cerebral posterior cerebral artery. Okay, so now these kind of the posterior cerebral arteries, they are also giving off these branches. You see these branches here. These branches here are what we call the posterior communicating artery. They are super very important in the formation of this ring-like structure which we are calling the circle of Willis. Okay, and then as they move up, we're also going to be having these branches here. You see this artery here. This artery here is what we call the internal carotid artery. So now this one here is going to be what we call the right internal carotid artery, and of course this one here is going to be what we call the left internal carotid artery. Okay. And of course, the whole of this structure here is what we call the optic chiasm. Okay, the optic chiasm. And this branch here is what we call the ophthalmic artery. And of course, when you talk of the ophthalmic artery at the back of your mind, you have to know that it's going to be supplying some different parts of what we call the eye and even also what we call the orbit. Okay. And then when we come out here, we have this branch here, super very important, which goes to supply different areas within what we call the cerebrum. And this one here is what we call the middle cerebral artery. Okay, so now this one, because it's on the left side, is just simply called the left middle cerebral artery. And in the opposite, you're also going to be having what we call the right middle cerebral artery. Now, this middle cerebral artery, it gives off these little tiny fibers of what we call these arteries. These little tiny kind of the arteries, which are collectively called the reticulostriate artery, which go to supply different parts of what we call the internal capsule. Okay, it is such another beautiful thing. Okay. So now, besides that, on the middle cerebral artery, besides what we call the reticulostriate artery, we also have this branch here. This branch here is very much important. This one is what we call the anterior choroidal artery. Okay, is what we call the anterior choroidal artery. Then, as you move up, we have this artery which are coming and then they move up like this. These arteries here are what we call. This is going to be now what we call the right, and this is also what we call the left anterior cerebral artery. Now, what is very beautiful is that these anterior cerebral artery, they are going to be having this the connecting the artery, which unites them to one another. In case there is a blockage in some of these major arteries in this side, this the connection here can also help to shunt the blood to go on to the other opposite side, which is having a damage for continuous supply of different the substances. Okay, and this the artery which is connecting the anterior cerebral artery is what we call the anterior communicating artery. Okay, it is such another beautiful thing. So now that briefly covers what we call the circle of Willis. Now what I'm going to do, I'm going to move off such that you have a clear view of this diagrammatic illustration and jot it down. Besides that, I'm also going to leave out what we call a clear picture, which is going to be demonstrating the circle of Willis in a clear kind of the view. You need to have a look at this by yourself. Thank you very much for watching, and if you think whatever I have talked is making sense, is adding to you, you have enjoyed, please you can support him. And that one can be done by a couple of means. You hit like button, comment down in the comment section, and please subscribe. So now in the next video, we are going to go through what we call the clinical correlation related is what we call the circle of Willis. What happens in case there is a narrowing of the great vessels of the circle of Willis, or even also there is a kind of the clot, or there is a narrowing in some of these major arteries, which are going to be part of what we call the circle of Willis. That's going to be our next video. As always, TUMNAD. Until we meet next time.